Good afternoon. My name is David Mitchell. I'm a 73-year-old on Medicare. 13 years ago, I was diagnosed with an incurable blood cancer, and I've been in continuous treatment since. Prescription drugs are keeping me alive, literally. My doctors currently have me on a 4-drug combination that carries an annual list price of more than $1 million. Just one of those drugs, an oral drug under Part D, cost me more than $16,000 this year out of pocket. Now that's going to change next year because of the Inflation Reduction Act. As out-of-pocket limits under the Act begin to phase in, and mine will be capped at about $3,500. It's life-changing. Eliquis is another drug I've been prescribed because I'm at high risk of a blood clot. The corporations that manufacture the drug have abused our patent system to block competition. Out-of-pocket costs for Eliquis under my plan is $3,200 per year, but help is coming. Eliquis is one of the first 10 drugs that Medicare will be negotiating in the coming months. Now, as hard as patients worked to win lower drug prices through the Inflation Reduction Act, we could not have done it without President Biden's leadership. We are so lucky that he brings his own personal experience and his family's and turns it into energy and commitment for the rest of us. President Biden also understands the critical need to ensure those of us who depend on new drugs for survival get the innovation we need, but at prices we can afford. So it's my great honor to introduce a man who is delivering on his promise to lower prescription drug prices, the President of the United States, Joe Biden. Thank you. Thank you.
Well, thank you, David. And this has been a fight that I just started the other day when I was a 37-year-old senator. This has been an ongoing fight, not just on my part, but on the part of an awful lot of people. David, thanks for sharing how we're making progress in lowering cost and for life-saving medicines. You know, we're here at a pharmacy today at the National Institute of Health to talk about my administration's work to crack down on price gouging, to lower prescription drug costs, to put money back in the pockets of hardworking families, and reduce government spending on prescription drugs at the same time. Usually when you talk about government doing something that's going to affect spending, you think it's going to be, we're going to help people and going to cost taxpayers more. But this lowers taxes as well as lowers costs for individuals. Too many folks lay awake at night, and I know from experience watching, that staring at the ceiling, worrying what will happen if their spouse gets cancer, or if their child gets sick, or something happens to one of them. Do they have enough insurance? Can they afford the medical bills? Will they have to sell the house? Will they? I get up, and you know, it's easy to understand it, and we all know somebody who's been through that experience. This isn't just about health care, it's about your dignity. It's about security. You know, I think some of the repressors was with me when I was in Northern Virginia, and that a very distinguished looking woman stood up, and she looked like she was in her early 40s, maybe a little older, and she said she had a problem. And the problem was she couldn't afford the insulin for her children who had diabetes. She had 2 of them. Talk about having to cut it in half. So, because the cost was as much as $800 a month for them, and her insurance couldn't cover it. Think of all the people in this country that are going through something like that. It's about giving folks just a little more breathing room. That's what this is about. For too long, Americans have paid more for prescription drugs than any advanced nation on earth. You can have the exact same drug made by the exact same company in the United States, and you buy it in America for one price. You go to Toronto, Paris, Berlin, or any other major capital in the world. In fact, you'll find they're paying 2 to 3 times less than the American is paying at an American drugstore. Folks, it's wrong. The result, seniors are skipping doses, cutting pills in half, foregoing prescriptions entirely because they simply can't afford the prescription drugs. But not anymore. We finally, after all these years, beat Big Pharma when I signed the Inflation Reduction Act to get seniors and taxpayers a better deal. For years, there's been no check on how high or how fast Big Pharma can raise drug prices. In the year before we passed this legislation, drug makers jacked up prices nearly 4 times faster than inflation went up, and they were already too high. Let's call this for what it is. It's a ripoff. They're ripping off Medicare. They're ripping off the American people. But we're now fighting back. As part of our law, which passed last year, drug companies can raise prices if they raise prices more than inflation, they'll have to pay back the difference between inflation, has it gone up, and the price they charge. And that means consumers will pay less as well. They're going to save taxpayers money and discourage companies from raising prices in the first place. Here's how it's going to work. And on its face, it seems complicated, but it's really not that complicated. Every quarter, Medicare publishes a list of drugs administered by doctors whose prices have been hiked too much too fast. Today, Medicare is announcing its latest list. 48 prescription drug prices were raised faster than the rate of inflation was raised in the same period. These drugs are used by 750,000 Americans. If medication you take is on the list, our program is going to keep your costs down. For example, many seniors taking the drug Signifor for growth hormone disorders, will save over $300 per month. In the last year, 64 different drugs have been listed for these rebates. Some seniors have saved more than $600 per dose. And that's not all. We're not only working to slow price hikes, we're also working to bring down drug prices, period, just bring them down. For starters, my legislation finally gives Medicare the power to negotiate to lower drug prices like the Department of Veterans Affairs has been able to do for a long time. Now Medicare is able to do that. We've been fighting for decades, and I literally mean decades, to give Medicare that right. With this law, we finally beat Big Pharma. And we got it done, I must admit, with no help from the other team at all. Not one single Republican voted for it. In August, the first 10 drugs were selected for negotiation. Drugs that treat things like arthritis, cancer, heart failure, and so much more. In all, this law is going to save the federal government $160 billion over the next 10 years. Hear me? Because Medicare is going to pay less, it's going to save the federal government taxpayers $160 billion over the next 10 years. That money will go toward reducing the deficit and not enriching Big Pharma. It also reduces the cost of insulin for seniors from as much as $400 per month to just $35 per month. It makes important vaccines for seniors like shingles free, saving them $200 per shot. And it's going to cap the total out-of-pocket drug costs for seniors on Medicare. Now, next year in 24, it's going to be capped at, no matter what your costs are, it's going to be capped at $3,500. But in 2025, it's going to go down to $2,000 per year, no matter how expensive your drugs are. And drugs, as you heard from my introducer, can be up to $10,000, $12,000, $14,000 a year for cancer drugs. David just said that his cancer drug costs $16,000 a year. Thanks to this law, he's going to pay a hell of a lot less. It's a real game changer. This law is going to lower costs. It'll save lives for people who forego drugs because they can't afford them. And I'll give folks a little more, just my dad just says, a little more breathing room. Just a little more breathing room. That's what Bidenomics is all about. Folks, negotiation and competition are the engines of a market economy. In every other industry, people negotiate prices every time. But with Big Pharma, it's been used to get its own way, no negotiation, suppressing competition instead of innovation. Drug companies say they need that extra revenue to develop cutting-edge drugs. Well, but studies show Big Pharma lately has spent more on stock buybacks, executive pay, and research than on research. Meanwhile, American taxpayers are footing the bill, more of the bill. Through their tax dollars, Americans pay more for federal drug research here at the National Institute of Health and other programs than folks in any other country in the world pay for. And we're happy to spend the money for the research because they do such good work. I believe it's a good thing that leads to breakthroughs that save lives. But drug companies benefit considerably from that research. They could not make their own drugs without the research done here. Taxpayers already are chipping in, paying a lot of money here at NIH to get these brilliant scientists to go out and find cures, find answers to drug problems, to drugs, with the use of drugs for health problems. And then they turn around and they charge Americans more because they charge than anyone else in the world because they, the private companies, take advantage of what happens here at this institute. I think it's outrageous. I'm pleased to announce that from now on, the part of the federal government that prepares for and responds to public health emergencies will make the so-called fair pricing a standard part of its contract negotiations with drug makers. That means American families will finally pay the same as people in other countries for many of the vaccines and treatments developed or funded through their own tax dollars in the first place. It's a simple principle. You shouldn't pay a highest price in the world for drugs that your tax dollars have already helped create. We're already begun to secure fair pricing clauses and contracts for new COVID vaccines, 3 new COVID vaccines. And we recently proposed that when a drug company prices drugs so high that Americans can't afford them, when those drugs were created by the American tax dollars, the federal government can step in and allow other companies to make and sell that same drug for less, because they did it here. This is all part of my administration's work to promote competition across our economy, to lower costs, to raise wages, and improve care. Last week, we announced new steps to crack down on anti-competitive practices in healthcare. And we're going after what we call junk fees, like junk health insurance plans that look affordable and then turn out to stick consumers with hidden costs they didn't know existed. We cracked down on so-called surprise billing. For example, when a patient goes to a hospital for surgery, and it turns out the anesthesiologist, maybe a wonderful man or woman, is out of their network, their insurance network, they get a surprise bill for thousands of dollars because it's not covered. They didn't know they were going to get that bill. They should be aware of it. We're protecting millions of Americans every month from these unexpected medical bills. We're taking steps to ban the use of medical debt in credit reporting. Think about this now. How many people have medical bills? If I added up all the costs of when I was in the hospital, it's literally several $100,000. Imagine had I gotten that and I didn't have insurance and I ended up in debt because of that. Well, the credit reporting is so families in the credit reporting, those bills cannot be held against you forever by denying your credit. So they're not counted in your credit statement. Folks, here's the deal. Americans don't like being played for suckers, but Republicans are okay with that. They're fighting to keep these junk fees. They're trying to cut Medicare, Medicaid, and Social Security, and they're very straightforward about it. And not a single solitary Republican voted for any of the legislation, which is responsible for so much of this drug savings. When I know some want to. Now they want to repeal the law and let Big Pharma charge whatever it wants for prescription drugs again. They want to send us back to the bad old days. In short, Republicans want to raise costs for seniors and working families and allow exorbitant profits for Big Pharma. I will not let that happen as long as I'm around. I'm a capitalist. Should be able to make profit in significant amounts of money. I have no problem with companies making reasonable profits, though, but not on the backs of seniors and working people. For too many folks, the cost of even just one drug can mean the difference between life and death, hope and fear. This is all about fairness. It's about dignity. As I was saying to these folks behind me before we came in, you know, imagine being that parent who has 2 children who have diabetes, need an insulin, and you can't afford it for both of them. Imagine this, you get stripped of your dignity. Look at your kids, you can't afford it. So we're going to keep fighting to lower prescription drug costs, not just for seniors, but for everyone. To expand health care coverage, to keep building an economy from the middle out and the bottom up, where health care is a right, not a privilege, and patients come out before profits. You know, I know we can do this, I really do. We just have to remember who in God's name we are. We're the United States of America. There's nothing beyond our capacity if we work together. And in this area, we're not only working to cut the cost for people needing the drugs, we're cutting the cost for the average taxpayer so they don't have to pay as much to fund Medicare. because Medicare's paying less as well. This is a double header. You save the taxpayer at large money because Medicare is not paying as much, and you save individual patients' lives as well as money. So I want to thank you all for taking the time to be here. I want to thank my introducer. I know you're down to 35, but it's going to get down to $2,000 a year, max, 2035. So God bless you all, and may God protect our troops. Thank you very, very much.
President Biden, do you want Israel to scale back its assault on Gaza by the end of the year? Do you want them to tone it down, move to a lower intensity phase?
I want them to be focused on how to save civilian lives, not stop going after Hamas, but be more careful.
Mr. President, can you explain more than that?
Is Israel committing violating international humanitarian